right, good morning, everybody. I will hopefully, be quick for you. We'll get you back on schedule. This one? Perfect, I'm one of the child life specialists here at Seattle Children's. I'm working this Saturday, so you guys get to see me, but I do have a patient shortly, so I'll probably be kind of going quickly. How many are familiar with child life and child life specialists? Anyone? There. Yay! So this might be kind of a review for you guys, but we're just going to kind of talk about the child life department here. So maybe we'll use that. So what does the child life department consist of? We have child life specialists, which is what I am. We have playroom programs. So we have playroom coordinators. They run the inpatient playrooms, as well as the outpatient sibling playroom. And then we have therapeutic play that kind of falls underneath our department, which is music therapy and art therapy for inpatient hospitalized kiddos. So what is a child life specialist? For those of you who don't know what we do, child life specialists are experts in child development who help patients cope with healthcare experience through play, preparation, education, and self-expression activities. We provide emotional support and encourage healthy development of children facing a range of challenging experiences related to healthcare and hospitalization. So oftentimes what we're doing in the hospital is kind of preparing children for procedures that they're going through, potentially stressful events, and trying to normalize the situation as much as we can here at the hospital. It's never going to be a normal environment, but if we can try and make it as good of an experience for kids, that's what we want to do. So how can we help actually with, preparation? So if you guys are coming in for surgery, not as a small infant, but as an older child, we do a lot of surgery preparation. So we can send kids home to families so that they can kind of understand what the process looks like here. We can also do preparation the day of. So we show anesthesia masks. We talk about what's going to happen before surgery, what will happen after surgery, kind of what that process looks like. We provide actual procedural support. So whether it be inpatient or outpatient, in the lab, in radiology, we are there to kind of help you through that procedure. So whether it's explanations while the procedure's happening, and then distraction and diversion. So if we can provide, like right now, I've got an iPad and stickers. We do social stories for kids, give them choices and control to kind of help them through that procedure. So that's part of our role here. And then assessing coping difficulties. So are we having trouble? And like we were just talking about, are we having trouble with intermittent catheterization? How can we help kind of create this coping strategy for you? What's going to make it best? Is it control? Is it having choices? What can we do to kind of help foster that and kind of make our way through that, and so that we can help provide some real understanding for kids related to that. New diagnosis is something that we help with in the hospital a lot. Limited family support, pain. I think pain is often something that comes up, especially with surgical procedures. So we are there to kind of help support that, whether it be through non-pharm like pain management, so guided imagery, making sure that we talk to the appropriate people if acupressure is something that would be good for your patients, things like that. Sibling support, so just because we have lots of patients here, we probably have lots of siblings too. Siblings often don't understand what's going on or why mom or dad are at the hospital all the time with brother or sister, or what, kind of how we can help that. So we're there to kind of help be that explanation for the siblings and kind of make it so that it's developmentally appropriate for them. Why are we here? What are we doing? Kind of how is this, going to affect them long term? Because it affects us and it affects our families when we're here at the hospital. Compliance, so medication compliance, procedural compliance. We do a lot of compliance for long-term patients. How can we help that? How can we kind of help foster that in just feeling of mastery over something? And how can we feel like we're doing positive changes for making a difference with kids in compliance? End of life and staff education are things that we also do as part of being child life specialists. Where do we cover? I kind of already touched on this. Inpatient units, so medical, surgical, ICU, cancer care. Surgery center here, surgery center at Bellevue, and outpatient areas at Bellevue, so radiology at Bellevue. radiology here, the emergency department, hemat clinics, and ambulatory clinics. This is pretty typical of hospitals across the nation, or children's hospitals across the nation, that there is going to be child life coverage in all of those areas. I've worked here, I've worked at Phoenix Children's, I've worked at Nationwide Children's in Columbus in the 11+-ish years that I've been doing this, and all of these areas are generally covered. So if you have kids coming into surgery center radiology, ambulatory clinics, there should be child life there if you don't come to Seattle Children's specifically. So, actually, I'm going to go back to that last slide. To get child life services, if you're a patient or family and you're like, well, we're coming in outpatient, you can always talk to your provider. They can contact us, but you can also, most child life programs too are completely open and receptive to parents reaching out to us specifically as well. So if you have a patient coming in for an appointment and you're like, I really want a child life specialist there, I want help explaining this to them, I really want someone to help me kind of walk through the motions. What does it look like at this particular procedure if I'm having VCUG in radiology, or what does it look like if I'm having a urodynamic study? We can provide that information to families to really help them kind of understand the process beforehand and do it in a way that's appropriate for kids. And then we are happy, if we are available, to meet you guys during the actual procedure and make sure that we're providing support so that we can kind of help best kind of get through that procedure for you guys. So you guys make a difference. By trying to understand a hospital experience from a child or adolescent's perspective, you can make a positive impact on his or her current and future experiences, and that really is what Child Life is trying to do, and we are trying to just help advocate for patients and families and helping families feel empowered to really get the best experience for their kiddo as well while they're here. So I think Child Life is the best in the whole hospital, clearly, because we have the most fun job. We get to play and explain things to kids, but we definitely are wanting parents and families and providers to, value that child's perspective as well. So.